Alright, so in this section we're talking about specifically male and female types of cancer. So one of the most prevalent types of female cancers that people think of is breast cancer. It's the most common malignant tumor originating in the breast tissue. Right, in 2012, our incidence was about 226,870 cases. 99% of those are women. About 1 in 8 women are diagnosed with. So if you just think about that, about in how many women you know in your life, out of all the women that you know, 1 out of every 8 can be diagnosed in their lifetime with breast cancer. It's the second leading cause of cancer deaths or mortality that we have in women. So signs and symptoms or clinical manifestations, they can be asymptomatic, meaning that they don't really have any symptoms and it gets picked up on a screening such as a mammogram. This is why we also encourage women to do self-breast exams, and they should be done every month, right? So they're looking for localized symptoms that maybe they hadn't noticed just with their busy lifestyle or not really paying attention. When they're doing their self-breast exams, they're looking for lumps or masses. They should be feeling all around their breast tissue, all around the nipple, as well as up into the area of the shoulder or clavicle and into the armpit, because there's still breast tissue back into the axillary area. They should be looking to see if they have any changes in their nipple shape, like retraction where the nipple is dimpled inward. If they have any weird discharge from the nipple. They could be experiencing pain or redness as part of their breast tissue. Their lymph nodes may feel swollen in that area, especially in the axillary area as well. Symptoms of advanced disease depend on if there's metastasis or tumors that have spread to other areas of the body. They may experience bone pain if it's in the bone, shortness of breath if they have tumors in the lungs, abdominal pain if they have any tumors in their belly area, jaundice if it's impacting the liver, mental status changes if it's in the brain, as well as headache. On their lab test, they may be looking at tumor markers such as the CA levels or CEAs. These are blood tests that measure proteins that are released by the tumors as they grow. Right? They could also have alkaline phosphate level changes if it's in the bone, because as it invades bone, it's going to break down bone and release phosphate. We'd also monitor their liver function test if they have liver metastasis as well. Things that increase a woman's risk for breast cancer. Things we can't change are known as non-modifiable risk factors. Being female puts you at higher risk. Age, as women get older, that increases risk. Family history, especially if they have a first-degree relative, such as a sister or a mother who's been diagnosed. The amount of estrogen they're exposed to in their lifetime. Alright, and this has to do essentially with the number of ovulation or ovarian cycles that they go through. Alright, the higher the number of ovarian cycles, or essentially the higher number of ovarian cycles or periods that they have during their lifetime is going to increase the amount of estrogen they have. This has to do with the fact that as women go through a menstrual cycle, they have increasing levels of estrogen depending on what part of the cycle they're in. So the more times they go through it, the more estrogen exposure they have in their lifetime. So things like having a period early in life, that would be early menarche. Late menopause, right? If they don't go through menopause till later on, right, then they're going to have more periods if they start sooner or end later in their lifetime. Nulliparity means that they've never been pregnant. It has nothing to do with whether they have infertility issues or not. It just means that they've never been pregnant for whatever reason. Again, because when a woman goes through pregnancy, that ovulation cycle or ovarian cycle halts during the time of their pregnancy. So the more times they've been pregnant, the less ovarian cycles they have been exposed to. If they have genetic mutations, particularly the BRCA gene or the BRCA gene in genetic testing, if they've had any history of a benign breast disease, or if they have high density breast tissue, this puts them at increased risk. Modifiable risk factors are related to high alcohol consumption, elevated body mass index or BMI, if they're later in life when they had their first child, or if they've been on prolonged birth control pills. So what happens in breast cancer is that the epithelial tissues of the breast tissue has a proliferation disorder. Essentially, too many of them grow than is normal, and eventually those cells will form a tumor. There are different types. There's estrogen receptor type, or known as ER positive. That's about 70% of cases. There's also progesterone receptor type. It's been linked to the HER2 oncogene. Right, whenever we see the HER2 oncogene, it's in about 20% of breast cancer cases, is going to amplify the breast cancer replication rate. There's other genetic mutations that we see as well too. All right, those are the common alterations like the PTEN. The BRCA gene 1 and 2 are our major indicators of heredity of the disease. These are the ones that if someone's diagnosed with breast cancer, they want to do genetic testing for, because if it shows up in other family relatives, then they know they're at high risk. Breast cancer will often spread to the lymph nodes in the armpit or the axillary area, and once it's in the lymph nodes, it's in the lymphatic system, and it's very easy for it to travel to other sites and cause tumors there and metastasis. Common areas that breast cancer will metastasize to are the bone, liver, lungs, and brain. To diagnose breast cancer, they're going to start off with a physical exam. So they will see if they can palpate a mass. They're looking for those localized signs of cancer, like the nipple discharge, asymmetric changes to the breast tissue, like thickening or nodularity. They'll compare one breast to the other side to see if they look different, or any skin changes like redness or pain at a site. They can also do a mammogram, and this is why once women get into the high-risk age category, they recommend regular mammogram screenings. If cancer is suspected on a mammogram, and here's images, all right, these areas here are tumors that they're concerned about, they would follow up with a biopsy. They may do the biopsy while being guided by an MRI or an ultrasound, right, in order to get a good sample. Right. The biopsy can be done either with a fine needle aspiration, where they will insert a needle into the tumor and aspirate cells to investigate them, a core needle biopsy, right, which is where they take a larger bore needle, insert it, and then when they retract the needle, they take a core sample or a piece of the tissue with it. Or they can do an excisional biopsy. An excision means that they're going to cut in a wedge, right, around it, excise or take out that piece of tissue and the tumor with it, and then sew it back up. This is more invasive, so it's less preferred. Right. What they're doing is with the tissue, they're going to take that tissue, they're going to put it under a microscope and analyze it. A pathologist is going to look at it to see if there's dysplasia, metaplasia, or other abnormal cancer cells growing. Next up is ovarian cancer. This is a malignancy that most commonly arises from the epithelial cells of the ovary. That's about 85 to 90% of cases. Right, there's also stroma or germ cell type ovarian cancer. Right. It's our most common type of cancer diagnosed in women in their mid-50s. It's the 5th most common cause of cancer-related death in women. Just a little review. When we're talking about anatomy, all right, the ovaries hang out on the sides of the uterus, all right, off of the fallopian tubes. Risk factors for ovarian cancer include family history. That's the number one. All right, 10% of all cases are familial. It is also associated with the BRCA1 or BRCA2 gene mutations. All right, if women actually have these genes in their genetic testing, then they recommend that they get a oophorectomy, which means removal of the ovaries after the woman turns 35 and she's done having children. It's also highly associated with another genetic syndrome called Lynch syndrome. If women have never had children, or in this case if they're also infertile or having infertility issues, they're at increased risk. We're back to the ovarian cycles. Again, if they've had early menarche, late menopause, they're at higher risk. If they've had a condition called endometriosis, or if they've been exposed to certain environmental irritants such as talc, smoking, or if they're obese. All right. So what happens in the patho of ovarian cancer is that the malignant or the epithelial cells of the ovary often become malignant and they transform. This has to do with minor trauma associated with ovulation. So every time a woman has a period or goes through a menstrual cycle, all right, they form an egg in the ovary that matures and then it gets released through the fallopian tube and into the uterus. All right, what happens then is every month roughly that they go through an ovarian cycle, when that egg needs released, it causes trauma or a little bit of irritation and damage to those cells of the ovary. All right. The most common type of ovarian cancer usually presents with advanced disease. As that egg travels here, it is going to take along with it any cancer cells that are in the ovary. And that means that as it goes through, it can shed those all along the female reproductive tract. The symptoms are usually not really picked up on until it's advanced, right, which makes it very difficult to treat ovarian cancer. Right, it is common spread in the areas of the ovaries and where that egg can travel around to. All right, so the female reproductive tract, also the peritoneum area, the omentum, lymph nodes, and that lower pelvic region, the small bowel, and the bladder as well. Symptoms are also pretty vague at first and often get misconstrued by the patients for problems related to PMS. Things like bloating. Early satiety means that their tummy feels full after they've eaten very little. Anorexia, where they just don't feel like eating. Dyspepsia is difficulty with digestion. Just a general feeling of abdominal fullness, cramping, pain, urinary frequency, fatigue, and weight loss. On exam, practitioners may see ascites, which is fluid buildup in the abdominal cavity, fluid in the lungs, which is pleural effusion, decreased albumin on their lab test. All right. They could also see breast cell carcinoma, masses, and advanced disease complications like cachexia, bowel obstruction, and adenopathy. To diagnose it, they usually have to do surgery and then get a sample, and they will determine if it's cancer or not. All right, it's important to have a surgeon who is familiar with the gynecological aspects as well as an oncologist. They could diagnose and be very important in diagnosing the staging of ovarian cancer. They may also try to debulk the tumor and also to try and leave behind some of the ovary in order to maintain normal hormone levels for the patient. Surgery is often also followed up with chemotherapy. Right, chemotherapy can be given intraperitoneal, where it is infused into the peritoneal cavity. A valve is closed so that it can wash over or spend some time dwelling in the cavity to help to eliminate any cancer cells that may have been shed through the reproductive cycles that were missed during surgery. At the end of the dwell time, the catheter is then open so that the chemotherapy can then drain out. Another type of female cancer is cervical cancer, where the bottom part of the cervix and the uterus can be cancer or be impacted by cancer. And we will pick up here with our next video.